Essex leprosity fracture. The definition of Essex leprosity. Essex leprosity fracture is a radial head fracture with disruption of the interosseous membrane and an injury to the distal radioulnar joint. Injury of the distal radioulnar joint can be a subluxation or dislocation of that joint. The Essex leprosity injury affects the axial stability of the forearm. It's an injury to the interosseous membrane and the triangular fibrocartilage complex, which can result in proximal migration of the radius. The triangular fibrocartilage of the wrist is the primary stabilizer for the DRUJ. This Essex leprosity fracture is difficult to diagnose, and the physician must restore the stability of the elbow and the DRUJ. Radial head fractures are a common elbow fracture. It constitutes about 1/3 of the fractures. The mechanism is usually a fall on the outstretched hand. The elbow will be in extension and pronation. There will be axial load transmitted from the wrist to the radial head, which is combined with a valgus force, and that will create a fracture of the radial head. The radial head provides two types of stability: valgus stability. The radial head is secondary restraint to valgus load at the elbow, and longitudinal stability. So it prevents proximal migration of the radius, and there is some contribution from the interosseous membrane. Loss of this longitudinal stability occurs when the radial head fractured plus injury to the DRUJ, and the interosseous membrane will be ruptured in this situation. In this situation, the radial head should be fixed, or if the radial head is unreconstructable, replace the radial head by radial head prosthesis, but never resect the radial head alone in this situation without replacing it. Radial head excision will result in proximal migration of the radius and uncarpal impingement with distal radioulnar joint instability.